You are watching this video because your doctor ordered a video EEG monitoring test. It's common for people to be nervous about this type of testing, but we're here to answer your questions. We have the best possible team available at the Brigham and Women's Hospital. During this type of monitoring, we will admit you to the hospital to understand your seizures better. An EEG will be placed on your head, and you will be put into a private room with a video camera on the ceiling so that we can see what your seizures look like on the video and EEG simultaneously.
The clinical team has advanced expertise in EEG interpretation and epilepsy treatment. Specialized monitoring equipment is not available at most hospitals. The duration of a typical stay varies. Most stays last 5 to 7 days, but we may ask you to be prepared to stay longer. Sometimes when patients have not had an event by the midweek, the attending doctors may ask to increase the likelihood it will happen by using one of several methods, including changing your sleep hours, breathing exercise, asking you to watch flashing lights, or bringing down your medication.
While you're admitted, you will have a specialized room with expert neuroscience nurses. Our priority is to always keep you safe. Every nurse that will be taking care of you during your stay has had formal training. We know exactly what to watch out for and what to do if a seizure happens. Nurses are on the floor 24 hours a day, 7 days a week. There will always be someone assigned to you and watching out for you. If there are any concerns or issues while you're admitted, please let any member of your team know. We'd like you to know while we are monitoring you, we will ask you to adhere to specific protocols, including being on bed rest with bathroom privileges. This will help ensure that you are in a controlled and safe environment where your seizure activity can be properly observed and recorded. You will, however, have bathroom privileges to use a toilet, wash out, brush your teeth with the assistance of a staff member. If you are taking regular medications, please continue taking them, including the day of admission, and bring them with you in the original bottles. This includes all your anti-seizure medications. Do not reduce your anti-seizure medications on your own. You should also bring in any inhalers, birth control pills, narcotics, or pain medications you may be on in the original container. We will then be in charge from that point on to administer them to you. Narcotics are controlled substances and must be supplied by the hospital pharmacy or otherwise secured in a locked area. After an inventory is done, your family may take the medications home as long as we have the hospital supplied options. For your safety, you will wear a cardiac monitor with an alarm to alert the nurses of any unusual patterns. Another safety feature we use is to have you always wear a finger or ear sensor to alert the nurses of any oxygen or heart rate changes. An IV will be placed in your arm while you're admitted so you can receive medication quickly if needed for a big seizure. If it is deemed necessary, your team may recommend an injection to prevent blood clots, since most of your time will be spent on bed rest.
When you arrive to your room, you'll be greeted by one of our trained technologists who will apply your electrodes. Technologists will check your EEG recording and equipment every day. We'll have continuous video and EEG recording that is synchronized. This will help us determine the number and type of seizures you're experiencing and improve your treatment plan. The neurologists who interpret the data will review significant events signaled by you or the recording. We also have 24-hour monitoring by staff that will alert nursing staff of any clinical concerns. By recording your episodes, we can see exactly what happens to you during your seizures. The data is kept private and away from the view of other patients. For your privacy, bathrooms do not have a video monitoring. There's a curtain that we pulled around the bed when needed.
You will not be allowed to shower during your monitoring since the EEG monitoring wires must stay dry. We ask that you wash your hair the night before. Please do not use any hairspray, mousse, or gel in your hair on the day of your admission. If you have hair weaves or extensions, please remove them as they may interfere with the electrodes. Please arrive at the hospital's main entrance at 75 Francis Street and tell somebody at the front desk you are there for a long-term EEG monitoring admission, and you will need to go to the admitting department to check in. From there, you will be sent to one of our epilepsy monitoring rooms where your electrodes will be placed. Please do not chew gum while you're being monitoring, as it will interfere with the interpretation of the testing. Feel free to bring games, books, puzzles, or electronics. Before you are discharged, we will review the findings with you and what we recommend going forward. We will also schedule a follow-up with one of our clinicians or instruct you to schedule a follow-up with your local neurologist. Our team will try to update your neurologist before you leave the hospital. You may also be eligible to have an appointment virtually from home if you are in Massachusetts. You will also be given instructions on what to do and who to call if you have a seizure after you leave the hospital.
Thank you for taking the time to watch our informational video on the long-term video EEG monitoring at Brigham and Women's Hospital. On behalf of the entire team, we look forward to meeting you and answering any remaining questions that you may have.